From the meeting here, we've seen what I think is evolution rather than revolution in hormonal therapy for prostate cancer, but it has been interesting. So we saw an update on the Latitude trial testing abiraterone in hormone-sensitive prostate cancer. That data already looked very impressive, and the longer follow-up continues to make that look the case. However, we also saw a trial called ARCHES. So this is a study testing the use of enzalutamide in the same setting, but there are a couple of important points about the study. Firstly, it has a wider eligibility. It was people with metastatic disease compared to Latitude, which had high-risk eligibility criteria. And so the study provides a broader look. And it was positive for radiographic progression-free survival, showed an advantage. We haven't seen survival data yet, it's immature, and so I think most clinicians will probably want to wait to see that coming first. The other important point about the trial was that about a quarter of patients had had chemotherapy for hormone-sensitive prostate cancer. So this is the first time that we've seen randomized data of hormonal therapy of one of these agents in people that have had chemotherapy, and the subgroup analysis would suggest that benefit was maintained in the people that had had chemotherapy. So that's interesting, and it plays into this idea of whether or not we might get to the stage of giving chemotherapy as well as one of these newer hormonal agents. I don't think we're there yet. I think the trial needs to present survival data first, but it does look promising. And then finally, the other main area was that we saw a trial for non-metastatic non-metastatic castration-resistant prostate cancer of a drug called darolutamide. And we've seen positive data for enzalutamide and apalutamide, so in that sense the efficacy data look very similar, and this appears to be another option. What was striking was that the toxicity data looked very minimal, and the drug is supposed to have potential benefits in terms of being less likely to cross the blood-brain barrier. Whether that really is a genuine difference in toxicity compared to other agents, I think is difficult in terms of cross-trial comparisons, but I think there is a sense that this may be an easier drug to use.